Hola, Vardians. Let's get into the question of the day. True or false? You need a doctorate degree to practice as an occupational therapist. And you know it, the answer will be at the end of this episode. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Welcome back. We have another Vardian here today, and that means I'm doing an interview. I'm having a guest speaker on, and I'm very excited. She is an occupational therapist. She's going to be our second occupational therapist. She's actually been working for a little while. So we'll get into it, see what she does, how she does it, what her journey is. I'm excited to get into it. So let's do it. Megumi, welcome. How you doing?
Hi, thanks for having me. So I'm Megumi, and I'm a occupational therapist, and I'm working currently in the pediatric population.
Okay, amazing. So, how long have you been practicing as an OT?
It actually hasn't been long. I actually started working last May, so it hasn't
Okay.
been a year yet. Yeah.
Okay, congratulations.
Oh, thank you.
I know that whole process of any healthcare path is like a headache. So I'm very excited to see you on the other side.
Yes.
Has
Finally, I
it
made
been,
it.
I know you really did. Has it been anything and everything you expected going through it when you were working towards an OT career?
Kind of. I didn't know grad school would be that tough. Or
Mm.
actually, so I finished undergrad and then I worked full time for about 2 years.
Okay.
But kind of like that transition going back to school full time was like extremely hard for me.
Yeah.
That
Yeah.
yeah, but everything besides that was kind of like what I expected. I knew like grad school was my priority and
Hmm.
like everything else kind of had to wait. So
Right, right. Yeah, it's
yeah.
it's hard. It's hard, especially once you're making a little bit of money. You're building a little bit of life on the side, and then you're like, all right, let me do it. I gotta put into it and put everything aside and prioritize these next 2 or 3 years and just get it done. Right?
Yes.
Yeah, yeah. No, I get that, but I'm glad you're done with it. Did you do your doctorate because I know OT have the doctorate option, or did you only do the masters right now?
Masters. Right now I only did the masters just
Okay.
because I wanted to start practicing as soon as possible and get experience. And then, um, like I was thinking, like maybe down the line in the future, I can always do like a postmasters to like bridging to a doctorate. So yeah,
Right.
I just wanted to start working.
No, that I totally get that. And how did you end up in the pediatric population? What draws you to that population specifically?
So I was always kind of drawn to the pediatric population. Like
Mm-hmm.
growing up, I was, kind of like taking care of kids. My mom loves kids. Um, and then I worked as a infant teacher.
Okay.
It's kind of yeah after undergraduate school. So for I was like a clinical director for an infant program for those
Mm-hmm.
2 years,
Okay.
and then I also shadowed like different populations for um, the hours you need for OT school. And I
Right.
tried everything like inpatient, outpatient, like home health, kind of like every hand therapy, every bit. But
Mm.
I think I'm just most passionate about pediatrics.
About pediatric.
Yeah.
Okay. So what your patients, what are they usually needing you for? What conditions or life events usually end them lead them to need an OT?
Yeah. So I would say um, it's a lot of different like diagnoses. Some of them are
Mm-hmm.
just, typical developmental delays,
Mm-hmm.
or some of them has diagnoses, like specific diagnoses like spina bifida, autism, Down syndrome. So some diagnoses, also just yeah, like medical conditions that they they were in the NICU for a month, and or like 6 months, or yeah, it just depends on the kiddos. But some of the things I work on is majority play because um, play is the children's like main occupation that they do. But I
Mm-hmm.
also work on like feeding is a one of the most, I would say, biggest concerns for parents. Like if they're very picky eaters, or
Mm-hmm.
they have difficulty like swallowing, or they have oral motor difficulties.
Mm-hmm.
Yeah, it's a lot of yeah, different things.
Yeah, yeah. So, are the parents coming to you directly, or is the PCP referring you to them, or what? Or maybe it's the social worker. What's usually that path like to from them getting their diagnosis to coming to you?
Yeah, so usually, so some of my, I would say majority of my caseload is through regional centers,
Okay.
and so the PCP will refer them to the regional center. So
Okay.
most of my clients are from 0 to 3 years old, and then if they do have a diagnosis like autism, they'll come from either like private insurance or
Mhm.
Kaiser or Easter Seals.
Okay. As we know you love kids, what are some challenges you have working with not necessarily this population, you can go into that, or just in general as an OT?
Yeah, I would say one of the biggest challenges is I guess parent follow through would be,
Mm,
I think, one of the biggest challenges, because I can do as much as I can for, the hour that I'm with them. But
right.
if there's kind of like no follow through at home, it's like you will see so much more progress way faster if there's
Mhm.
like really good follow through.
Right.
Yeah.
That's fair. And what's your favorite part of it?
My favorite part is, I think, just the kids, and like you see their progress sometimes
Mhm.
week by week, which is like really fast.
That's
And
good.
then you get to experiences like a lot of firsts with the
Mm,
parents,
mm.
because yeah, you're kind of teaching the child how to do certain things, and then like during sessions it might be like their first time
Wow.
like walking. Yeah, so it's a lot of
That's exciting.
it's really rewarding. Yeah.
Yeah, that's definitely exciting. So like because parents like I know parents get a big deal out of like making sure they see the children's first. So like you essentially have like a lot of children.
Yes, basically, yeah, I have like 35 kids right now.
That's a lot, Megumi.
I know,
Slow
right?
down. But that's cool. So let's go a little bit into your educational journey. What did you do undergrad? Let's start there. Like, what did you do for your undergrad degree?
Yeah, so for my undergrad degree, I got it in kinesiology,
Okay.
and yeah, I took 4 years for that,
Mm-hmm.
and then I took 2 years off of school just to kind of get money for grad school and get a little bit of like full-time experience before
Mm-hmm.
I went into masters for 2 years.
Okay. And how did you hear about the profession, OT profession, and what was the decision making process for you?
Yeah, so actually, before I didn't even know, when I started grad school, I didn't know what to do at all. And then my dad was like, everything is business, so go into business.
Oh,
And
that
I was
sounds like
like,
my dad.
that's right. Yeah, and then but then like I knew like business wasn't for me, but then I went into like when I was applying for undergrad as like a business major. But I was like, I'm
Mhm.
not gonna take business classes at all. I'm just gonna do G's the first
Yeah.
2 years and kind of like try to find out what I like.
Right.
And then I took a bio class. And
Mm-hmm.
I think that was like really like, oh, I was like, I love bio. I'm gonna be a bio major. And
Uh-huh.
I talked to some friends that were in bio, and they're like,
Mm-hmm.
do you like microscopes and like laboratories? I and I was like, no, not really. And then actually, yeah, it's actually a friend that introduced me to like kinesiology, like in that
Mm-hmm.
field of like the human body.
Uh-huh.
And then I kind of like, I literally like fell in love with like kinesiology, and I
Kinesiology.
was like, okay, this is it, and this is for me, this is my major.
Uh-huh.
But then I didn't find out about OT until So everybody was either becoming like a physical therapist that I knew,
Mm-hmm.
or like an athletics trainer, like they
Mm-hmm.
loved working out, or like they just wanted to either do like research and like motor behavior, motor lab, or
Mm-hmm.
but I was like, none of them are kind of like like it
You're
doesn't
like,
really, it's
this
not
is
really
not clicking
calling
with
to
me.
me. Yeah,
You want to
I
have
was like,
anomaly, like, I had to find another thing.
yeah, yeah. I was like, I need to find something else in
Yeah.
this kinesiology field.
Yeah.
And then it was actually like a guest speaker that
Mm.
came, one of my like core kinesiology classes where they introduce like a lot of professions within the field, and then
Mm-hmm.
that's when I learned about occupational therapy, and I was like,
I
oh
see.
my gosh, like everything they were saying, I was like check check check, and
Mm-hmm.
then yeah, and that's
You're
when
like,
I
that's
kind of,
me. I
yeah,
found it.
I was like, I found, thank
Yeah.
goodness, yeah, and I was like, I felt so blessed. I was like, oh my goodness, like this is it, I found it.
Mm-hmm.
So
Mm-hmm.
since when I found it, I kind of like, I don't know, built my career path
Mm-hmm.
that way.
Too much. Yeah. That makes sense. That makes total sense. It's definitely an amazing thing when you just searching and try to figure your career out and you feel like, I found the one. I
Yeah,
really
yeah,
found
like
the one.
yeah.
So yeah, no, I get that. So where did you? What was the application process like for you to OT school? What were some of the major requirements?
Yeah, so I would say major like prerequisite classes is like anatomy and physiology,
Mm-hmm.
statistics. There was also like a lifespan course that was a prerequisite. Psychology was also a prerequisite,
Mm-hmm.
and I think there was a couple more. And then depending on like, the grad
Cool.
school, yeah, they had like different requirements, but
Right.
I would say those were like kind of the core ones.
The main one. And then did you have to take a GRE for most schools require GRE?
Yeah, most schools require GRE. I would say half, maybe
Okay.
half require
Okay.
GRE.
So you can like
Yeah.
do without it essentially.
Yeah, right now, I guess right now you can. We'll see
Yeah.
about the
Yeah,
future though, but
it seems you're moving more toward that space where standardized tests or like they'll try to do without it, which I am personally very happy about it because I do not do well with tests at all,
me
like
too.
major test anxiety, and I'm just like, if I never take a test again, I am okay with that.
Yeah, same.
I am okay with that. So what about clinical hours? Do they require any clinical hours? And was that a requirement or more of like a preference, or like, oh, it's good for your application?
I think most of the schools required. I
Hmm.
think it was only like 30 or 50 hours, I think.
Okay.
But
Okay.
yeah, I just got a lot because I just wanted to know which kind of,
Yeah.
yeah, like
Yeah.
what the whole aspect of OT was.
Uh-huh. And it was specifically OT, like shadowing or following an OT, right? For
Yeah,
the hours. Okay.
specifically. Yeah,
Okay.
no
That
OT.
makes sense. And so essentially once you get in, are you guys doing clinicals after you have a didactic year and then a clinical year, or is it both combined?
Yeah, it was didactics and then the clinicals, like the 3 month clinicals. But then
Okay.
we had like there's like a week clinicals during like the didactics.
Okay. Okay. And as an OT, what's your day like?
My typical day
Yeah.
I would start about maybe I work full time, so I work usually just Monday through Friday, like
Hmm.
9 to maybe 4 or 6:30, depending on the day. But I would say I see kids every hour, so I
Okay.
would treat the kids for 50 minutes, and then I'll write my note, and then clean, disinfect, and then see my next kid. So it's
Hmm.
really busy day, yeah. And I'll see maybe about 7 to 8 kids a day.
Okay. All right. So yeah, about a kid an hour. That makes sense.
Yeah.
And so, and this is going back to more basic questions, but to ask, if you were to answer to somebody who's never heard of OT, what's an OT? What will be your answer?
Oh yes. I love this question because not a lot of people know about
Exactly,
occupational
and that's why I'm
therapy.
doing this.
Yes, thank you. Yeah, so we help people develop, regain, or like adapt skills to
Hmm.
participate in their meaningful daily activities. So I usually like to help people like think of everything you do from the moment you wake up till when you sleep. So it could be literally, you get dressed, you
Hmm.
toothbrush, you drive to work, you go to work, sleep. So these activities that we do, they're referred to as occupations,
Hmm.
and then they're usually confused with like jobs or careers. So
Hmm.
they're like, "Oh, can you help me get a job?" And I was like, "Kind of, but that's not like the whole occupational therapy
Right,
focus." But
right.
yeah,
They're
yes,
essentially like everyday jobs, right? Because these are things like we're expected to do. We don't think about them for those of us who are lucky enough to be healthy and have developmentally everything is good. But of course, the second you can't do it, then really becomes an occupation. Like you have to think hard about it and work hard at being able to do it. Like a post-stroke patient, like they were walking fine, but now it's a struggle being able to walk straight. So yeah, I definitely see the confusion there.
yeah.
But there you have it, folks. That's what an occupational therapist is. Um, Now, speaking of that, what would be your what are some leadership opportunities as an OT?
Yeah, so you could either, I would say, you could take on like fieldwork students. I would
Mm-hmm.
say that's a leadership opportunity. You can also supervise COTAs, which is a certified occupational therapy assistant.
Mm-hmm.
And then so you'll kind of collaborate with them and then kind of go over their caseload, and then you'll do like the evaluations for them.
Okay.
Or then, yeah.
So are they what's the relationship between them and OTs?
Uh, so they're kind of they work with like we collaborate each other. The main difference is probably just the evaluations.
Okay. Okay.
Yeah.
I don't think I've heard of that before. What's the full title?
COTA, so it's a certified occupational therapy assistant.
Oh, so like a PT and PTA and like dentist and dental.
Perfect. Yes,
Gotcha.
exactly like that. Yeah.
Okay, okay. There's a lot more like professionals with assistant than I thought there was before. I never knew. Like I know the big names, but then I realized like a lot of them have like
Like
assistant
the
levels.
assistant.
Yeah, that makes
Yeah.
total sense. Okay, okay. Um, what about work-life balance?
I would say I will have a pretty good work-life balance just
Mm-hmm.
because I feel like the 2 years that I did work full time, it really helped me. I feel like kind of get back into the working full
Mm-hmm.
time
Mm-hmm.
groove. I also like try not to take work home at all. So all my paperwork,
Everything.
like whenever a kid cancels or like they kind of no show, I'm like, okay, I got to do this report, and I like try to finish the report on time. Yeah,
Mm-hmm. Mm-hmm.
yeah, I would say I will have a pretty good work life balance.
Good, good. That's very good to hear. And what do you do for fun?
For fun, I like to do anything outdoors. I love nature, so camping, like
Mm-hmm.
snowboarding,
Mm-hmm.
hiking. Yeah, just find me outside, moving my body somehow.
I
Yeah.
love it. This is state for it. This is state for it.
Yeah.
um, do you have any professional future aspirations right now?
Right now, I would say um, I would. I'm kind of interested in the school setting
Mm-hmm.
too. So maybe in a couple of years I'll try out the school setting.
Mm-hmm.
There's also advanced practices in OT. So there's like hand therapy or PAMS, which is
Mm-hmm.
physical agent modalities,
Okay.
or feeding and swallowing. And then so I'm kind of looking into the feeding and swallowing advanced practice.
Okay.
It will take a long time for that.
Yeah.
Yeah.
So is that a certification? Or is it like a specialization?
Yeah, I took a specialization certificate.
Okay. And do you
Yeah.
go back to school for training for that, or do you work in that field and get the certification?
Yeah, so it's you have to work in that field, and somebody who already has the license has to be like your supervisor, and then you get your hours through there, and then you have to take a
Okay.
big test again.
Right. Not again.
I know.
Like I'm legit like I'm a part of me wants to do like as far as my personal aspiration, like I want to do like psych specialization as a
Oh,
PA, but
hmm.
I'm just like the test.
It's those tests. I know.
I think maybe in like 2 years when I'm more like separated from my trauma of tests, then I can think I can try again. But right now it's too fresh. Like
It's
I can't think
yes.
about it.
I understand.
I'm
Yeah, that's
working
why I was
with
like,
my life.
maybe yeah, down the line. Like I'll
Yeah.
think about it. Yeah.
Yeah, listen, let's enjoy this thing that we worked for so long, okay?
Yes, yes.
So just enjoy it for a little bit before we even think about taking more tests. That's enough tests. That's enough tests for now. Um, so we got that. What would you say is what would you give an advice for somebody who wants to be an OT?
I would say, oh, the one thing I wish I did when I
Mm-hmm.
first got into OT school is make a separate email for OT.
Mm-hmm.
Just because we're for our school we use a lot of like Google Drive and things, so all of like your OT resources could be in that one email. So I did a lot of like transferring from my personal account to my professional email just so I
Mm-hmm.
could have all my resources in one place.
That's
And
very smart.
yeah. Yeah, that's one thing I wish I did. I would say like nurture like the family environment with your cohort.
Mm-hmm.
I think that's one of the biggest. I also got that advice from one of my OT mentors, and she said literally your cohort is like your family. You'll see
Mm-hmm.
them more than your own family, you know. So yeah, kind of. I know everyone's kind of like competing to get into OT school, but like once you're in, you guys are literally in. So
Yeah.
like kind of just like help each other out instead of trying to like compete.
But yeah,
So,
yeah,
yeah.
yeah. No, that's a great advice. I'm sort of doing things backward here because we're having so much fun and I'm not paying.
No problem. No problem.
So I'll make this my last question. That was supposed to be my last question, but my last question today is, what do you do? I know you're pretty new in the field, but what do you do to sort of keep your knowledge up to date?
Oh yeah, I love the continuing education courses
Mm-hmm.
that we have to take to kind of like just maintain your license.
Right.
And yeah, so I take these continuing education courses specific to my field. So
Mm-hmm.
just about pediatrics and anything pediatrics really. And I also, if I learn something from that, I try to find like a research article just to support the interventions that I'm
Mm-hmm.
doing for my kids.
Okay. All right. If you don't have anything else to add, that's all I have for you today.
Okay, thank you so much.
You're welcome. Thank you for joining. I appreciate you taking the time on the weekday, nonetheless. By the way, this is being recorded and it's almost 8 p.m. Okay, so just y'all appreciate the work we're putting in here.
I so yes.
Thank you so much, Megumi.
Of course. No, thank you.
Of course. You have a beautiful evening.
You too.
Alrighty. Bye.
Bye.
She's back, and the answer is false. You do not need a doctorate degree to practice as an occupational therapist. You do have the option, however, to get a doctorate degree, but only a master's degree is needed to practice as long as you pass your board exam. That's it. Adios. Alright, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed.